Have you been taking Amlodipine, Losartan, or Lisinopril every day without really knowing what could happen if you make one simple mistake? Most people believe that once they swallow their blood pressure pill each morning, their job is done. But that's not always true. In fact, some of the most common problems people over 60 experience aren't caused because the medicine isn't working, they happen because nobody explained what to watch for. One of the mistakes I'll share today can increase the risk of serious complications, and many people don't discover it until it's too late. And on this channel, I help adults over 60 understand their medicines in simple, everyday English, so they can stay healthier and feel more confident. By the end of this video, you'll know 7 important things every person taking these medications should understand, including one warning sign you should never ignore. Let's begin with something that surprises almost everyone. Before we talk about side effects and warning signs, there's one thing you need to understand. Amlodipine, Losartan, and Lisinopril all lower blood pressure, but they do not work the same way. That's important because they can cause different side effects, require different precautions, and sometimes need different advice from your healthcare provider. Many people assume a blood pressure pill is a blood pressure pill, but that's like saying every car drives the same just because it has 4 wheels. Each medication has its own strengths, its own possible side effects, and its own things to watch for. If you understand those differences, you'll be much more confident about recognizing when something is normal and when it's time to contact your doctor. And the first medication we're going to discuss is Amlodipine, because one of its most common side effects causes thousands of adults over 60 to worry unnecessarily every year. The good news is that once you understand why it happens, it's much less frightening. Let me tell you about James, a 72-year-old retiree who had been taking Amlodipine for several months. One afternoon, he noticed his socks were leaving deep marks around his ankles. By evening, his feet looked swollen, and his shoes felt much tighter than usual. Naturally, he became worried. He thought his heart was getting weaker, or that his kidneys were failing. What James didn't know was that swollen ankles are one of the more common side effects of Amlodipine. It doesn't always mean something is seriously wrong, but it is something you should discuss with your doctor rather than ignore or try to manage on your own. Some people stop taking their medicine without medical advice because of this swelling, while others simply suffer in silence. Neither is the best approach. Your doctor may be able to adjust your treatment or recommend another option if the swelling becomes troublesome. But Amlodipine isn't the only medicine that can surprise you. The next one can cause a symptom that many people mistake for a stubborn cold, and that misunderstanding can last for months. Now let's talk about Lisinopril, because one of its side effects has caused many adults to spend months treating the wrong problem. Meet Mary, a 69-year-old grandmother who developed a dry cough that simply wouldn't go away. It wasn't a chest infection, and she wasn't coughing up mucus. It was a constant tickle in her throat, especially at night. She tried cough syrup, lozenges, and even allergy medicine, but nothing seemed to help. She thought it was the weather or seasonal allergies. What she didn't realize was that Lisinopril itself can sometimes cause a persistent dry cough in some people. If you develop a cough that won't go away after starting this medication, don't stop taking it on your own. Instead, speak with your doctor, because there may be another medicine that's a better fit for you. However, there's another reaction that is far more serious. If your lips, tongue, face, or throat suddenly begin to swell, or you have trouble breathing or swallowing, seek emergency medical care immediately. Although this reaction is uncommon, it can become life-threatening if not treated quickly. And speaking of things that many people never expect, the next medication can create problems because of something that many families believe is actually healthy. Now let's talk about Losartan, because one of the biggest mistakes people make has nothing to do with forgetting a dose. In fact, it often starts with someone trying to make a healthier choice. Imagine Margaret, a 73-year-old woman who was told to reduce the amount of salt in her diet to help control her blood pressure. Wanting to do the right thing, she bought a salt substitute from the supermarket because the label said it was a healthier option. What Margaret didn't know was that many salt substitutes contain potassium instead of sodium. For many people, this isn't a problem, But if you're taking Losartan or certain other blood pressure medicines, extra potassium may not be appropriate and could become harmful. That's why it's important to tell your doctor or pharmacist about any salt substitutes, supplements, or electrolyte drinks you use. Never assume that natural or heart-healthy automatically means it's safe with your medication. And what I'm about to tell you next is something every person taking blood pressure medicine should know before they get sick with vomiting, diarrhea, or even a simple stomach bug. Here's a situation that catches many people by surprise. Imagine you've been taking your blood pressure medicine every day without any problems. Then one weekend, you develop a stomach virus. You're vomiting, you have diarrhea, you can barely eat, and even drinking water becomes difficult. Yet many people continue taking all of their usual medications exactly the same way because they assume that's always the safest choice. The truth is, being sick can change how your body responds to certain blood pressure medicines. When you're dehydrated, your blood pressure may fall lower than expected, and your kidneys may be placed under extra strain. That doesn't mean you should stop your medication on your own, but it does mean you should already have a sick day plan from the doctor who prescribes your medicine. Ask your doctor, what should I do if I'm vomiting, have severe diarrhea, or can't keep fluids down? Having that plan before you become ill can prevent unnecessary complications. But there's another everyday mistake that's even more common because it involves a medicine almost everyone has in their home. Now let's talk about a medicine that millions of people keep in their home without giving it a second thought: ibuprofen. If you have arthritis, back pain, knee pain, or muscle aches, you may reach for it because it's available without a prescription. But if you're taking Amlodipine, Losartan, or Lisinopril, especially Losartan or Lisinopril, this is an important conversation to have with your doctor or pharmacist. Regular use of anti-inflammatory pain medicines like ibuprofen can increase the risk of kidney problems in some people, particularly older adults who are dehydrated or who already have kidney disease. This doesn't mean everyone should avoid ibuprofen forever, and it certainly doesn't mean you should stop any medication on your own. It simply means that over-the-counter doesn't always mean risk-free. Before using ibuprofen regularly, ask your healthcare provider whether it's the right choice for you and whether another option might be safer. And speaking of everyday warning signs, the next one may seem harmless, but it sends thousands of older adults to the hospital every year after a simple fall. Let's talk about something many older adults dismiss with a smile: feeling a little dizzy when standing up. You may have experienced it yourself. You stand up from the couch, get out of bed, or rise from the dining table, and for a few seconds the room seems to spin. Many people simply say, "I got up too fast," and carry on with their day. But if this happens often while you're taking blood pressure medication, it's something worth discussing with your doctor. Blood pressure medicine can sometimes lower your blood pressure enough that standing suddenly causes a brief drop in blood flow to the brain, making you feel lightheaded. The biggest danger isn't the dizziness itself, it's the fall that can follow. A simple fall can lead to broken bones, a hospital stay, or months of recovery. A safer habit is to sit for a few moments before standing, rise slowly, and hold on to something sturdy until you feel steady. Now, before we finish, there's one final mistake many people make with their home blood pressure monitor, and it can lead to unnecessary worry and poor decisions. If you check your blood pressure at home, here's one mistake that creates unnecessary fear for thousands of people every day: reacting to a single reading instead of looking at the overall pattern. Imagine you wake up after a restless night, drink a strong cup of coffee, rush to answer the phone, then immediately sit down and check your blood pressure. The number is higher than usual, and panic sets in. Some people take an extra tablet without medical advice, while others become anxious for the rest of the day. But one reading rarely tells the whole story. Blood pressure naturally changes throughout the day, depending on stress, sleep, pain, activity, and even how recently you've eaten or exercised. The best approach is to measure it correctly, sit quietly for about 5 minutes, keep both feet flat on the floor, support your arm at heart level, and try to measure at about the same time each day if your doctor has recommended home monitoring. Record your readings and share the pattern with your healthcare provider rather than making changes based on a single number. And before we end, there's one final message every person taking these medications should remember for the rest of their life. If there's one message I hope you remember after watching this video, it's this: never stop, start, or change your blood pressure medication without first speaking to the healthcare professional who prescribed it. Medicines like Amlodipine, Losartan, and Lisinopril have helped millions of people lower their blood pressure and reduce the risk of serious problems such as heart attack and stroke when used correctly. The key is understanding how to take them safely, recognizing possible side effects, and knowing when to ask for medical advice. I hope today's video has given you more confidence and helped answer questions that many people are afraid to ask. If you found this video helpful, please subscribe to Silent Health Diary, because every week we share practical, evidence-based health tips designed to help you stay informed, stay independent, and protect your heart. Thank you for watching, take good care of yourself, and I'll see you in the next video.